I'd like to welcome everyone here tonight. My name is Emily McGregor, and this Dr. Christine is going to be a real treat for you ladies. I met Christine probably about a year and a half ago.
There's three gentlemen.
Oh, gentlemen, sorry, gentlemen. Sorry about that.
You got your back, it's okay.
Yeah. I apologize, ladies and gentlemen. So Dr. Christine I met, like I say, about a year and a half, almost, about a year and a half ago. And she's taught me so much about nutrition and just overall wellness. Come on in.
Come on in, have a seat.
Please tell her something to sit in the front row. Yeah, front row.
I would say, I don't bite.
Yeah. So as you know, she's a medical doctor, a naturopathic doctor, dermatologist, and the list goes on and on. So her knowledge is amazing. And her passion is to help everyone be healthy and live a good quality life. And that excites me too, because, nothing better than feeling good. You don't want to be sick and tired of feeling sick and tired. We want to feel great. So Christine, and she lives in Middle Sackville, right? Middle Sackville? Middle Sackville. And her and her husband, and she's got chickens and stuff like that, so she's a nature girl. Just like a lot of us, right? She likes her nature.
Lay hens in the backyard, we raise meat, birds, and things an owl.
Here. There we go.
Anyway.
So this morning, my husband sent me an email that he's always sending me stuff that I don't communicate back and forth on email. But however, he sent me one quote by Steve Jobs. Everybody knows who Steve Jobs is. I took one line out of it, which I thought was kind of cool. It says, "Eat your food as your medicine, otherwise you have to eat medicine as your food." So that's pretty powerful. And this is why we're here tonight. Christine is zeroing in on brain health. She's very passionate about this, and her background just really emphasizes that. She really wants to help us. So
I'll share a little bit about that.
Yeah.
So you know a little bit about me. Thank you very much, Emily. She has been a good friend all along, and I can even stay with her overnight.
Yeah, she's staying overnight. And
I said on Facebook earlier, hospitality knocked my socks off. So of me. But for the presentation, I put them back on. Maybe I shouldn't, but I like warm feet. And I can promise you one thing, you will not get bored. Because don't expect long bullet point lists, because there's always Mr. Google. You can get that. But you will get interesting information, you'll have some fun, and you'll learn something new or something to think about. Now, let's get started. And thank you all for coming. So many of you. I'm very humbled to see you all. Now, what are we talking about today? As announced, why we should look after our brain. Why? And body? What does it have to do? And what not to eat and to eat for better mood and more energy. That's quite important, how brain and body work together. Why is it that in our time those degenerative diseases increase so much? Children have ADHD, allergies, eczema, depression, it all raises. And I'll give you my take on why that is and what we can do to hopefully change it for us and the ones we love. And I also want to give you a little bit an idea why I am not 100% agreeing with calling certain things diagnoses that are really more labels. I'll give you an example. When you go to the emergency room with chest pain, they look for what it could be. Heart attack, stomach attack, or it could be from urine, that the nerve is pinched. They look for it. When you go to the emergency room and complain about sadness and depression, they prescribe an antidepressant and say that will do it. In my opinion, depression and other diseases are just labels that we give sometimes out of convenience because either we are not willing because it costs money, or we are not financially able in our health system to really look for more than just the service. Or we don't know it. There is strong interest groups in the conventional medicine field that is just focused on medications. And I mean pharmacological, and I'm not against it. And I'll tell you a little bit about what I really am and what I stand for. Take the next one. Now, who really am I? My name is Dr. Christine Sauer. Yes, I was born and raised in Germany. Always was a healer, I thought. Always interested in psychology. Was pretty smart. My parents were very much supportive of that. So I became a doctor. Married, had 2 children, which interrupted my studies for 4 years, but I just wanted to finish. So I finished my studies, became raised with my then ex-husband, my now ex-husband, a family practice, built a house. I'm a very hands-on person. So I organized all that and worked in the family practice with him for several years. He was an excellent family doctor in Germany. Family doctors do way more than here, including house calls and emergency visits. It was very interesting, learned a lot, became family doctor. Now then, my husband told me, listen, as a dermatologist you make more money. So I became a dermatologist, allergist, and I was a naturopath all along. My husband was a naturopath. In Germany you can be a medical doctor and a naturopath. That is not a contradiction like many see it here. That's something that I strive to change, because I think it should be more integrated than what it is right now. And it doesn't say that one goes against the other. So what happens? How did I end up here in Canada? I worked in my dermatology office for years, 16-hour days. Then I went home, worked some more in my ex-husband's family practice, participated in emergency visits, night shifts, whatever. I neglected myself. And something's got to give. For me, it was my back. One day I sat down in my office chair, I got back pain. I said to myself, now I am part of the 80% of the population that have back pain. So what? Continued working. In the evening, I hardly could tie my shoes. At that point, I had still tight shoes. And the next morning, I made it home, went to bed. The next morning, I couldn't get up, I couldn't walk. So my ex-husband called his ambulance friends. They had to carry me down the steps in the hospital. I went 4 weeks learning to walk again. I did it, went in a rehab program, started to work again. First part-time, then slowly more. Whoops, the second disc went. So now I had 2 disc pull-ups, and at this point I gave up. I just couldn't handle it. I sold my practice and did nothing but eat excellent German cake. So I ballooned out of shape. And on top of all that, I was depressed from losing my job, having nothing to do really, feeling miserable. And then my ex-husband, who had his own mental problems, decided to commit suicide. And I was left with 2 teenage boys and immigration papers to Canada. You see, 2 years earlier, no, actually 3 years, we decided, my ex and I, to ask for immigration to Canada to prevent our boys to have to serve in the then compulsory German army. And boys were drafted there at 16. So I was sitting there not having nothing to do, feeling miserable, having money enough to live, and immigration papers to Canada, and a house in Halifax. So I moved to Halifax. On the long run, best decision of my life, It was 1997 in the fall. On the short run, it made things so much worse because I was alone, no contacts. I spoke English, not very well. I was shy, I was depressed, I was miserable. I didn't even want to talk to anybody on the phone because I didn't want to bother them. Because my ex and my kids treated me as a doormat. That's what I was at that point. And one day, I felt so miserable, I didn't care about anything. I went into my van and aimed for Ridgepost. Thank God I didn't do it. A small inner voice told me, don't do it. You really want help, you don't want to die. So I went to the emergency room in Halifax, Q2. Was very fortunate, found an amazing resident who realized how bad I was. And I was 4 weeks in the Abilene, which is a mental hospital. Now, you can imagine when you're used to be a doctor treating patients, it's bad enough to be an inpatient in an orthopedic hospital, but being inpatient in a mental hospital is really very humbling, embarrassing, and I learned a lot. After the 4 weeks in the Abilene, I was transitioned in the 6 weeks day hospital program. Excellent program, just a day treatment program, counseling. And I learned the meaning of the word assertiveness, which I don't think exists in German at all. You're either subservient or aggressive. But the golden middle is not really defined clearly. At least it wasn't in my life at that time. So I learned that. And slowly I got a little bit better. Then I met a man from Halifax, and I call it synchronicity, because on the long run it was so unlikely that I ever would meet him. Because it was the first time I went to a singles dance. And for him it was pretty much the last time. And we would have never met because I hated it and would have never gone again if I hadn't met. And that was 20 years ago. So my back was shot, I was still sick, I was on heavy medication, I had panic attacks, I felt lousy. But at least I had a good husband. And I even got psychotic at some point, which earned me the diagnosis, yes?
No, just a
Okay.
spider.
Yeah, sorry. Which earned me the diagnosis eventually of schizoaffective disorder, depressive type. Which is really severe, and people think about people like that and say they never get healthy. That's why I decided now to share the story. And what happened is I struggled with my own health for 10 years, and up and down, up and down. At some point, I decided to make a change. I said, it can't be like that for the rest of my life. I'm just going downhill. I don't want to spend the rest of my life in a mental hospital, or God knows where. So I decided, hey, you know a little bit about it. Do some more research. There's Mr. Google, there's libraries, there's lots of good information, there's books. And I studied, I learned, and I applied it to myself. And that's the biggest change. You have to make the decision and then change it. And that was me in 2005. And I was 315 pounds. I smiled, but I wasn't happy. And 11 years later, I looked like that. And yes, I had help. I'm not against conventional medicine. I went to India to have gastric bypass surgery in 2006. When you look on YouTube, you can actually find a video from there. I look like that on this page. They didn't do it in Nova Scotia. They still don't. It was a good decision. I lost 150 pounds. I gained a few back, but not that many. And over time, it was supposed to help my back. It didn't. What helped my back was when I started the right supplements, the right nutrition, went to the right chiropractor. That changed my life. And the decision to do something to give back to others that may be suffering also and not knowing how to get out of it. And that's why I decided about a year ago to start really sharing my story and focusing on brain health, because I found that people with similar issues feel attracted to me because of my experience. I know how they feel. When I say that, I mean it. But I also know the way out of it. And go to the next one. And all those labels are really only symptoms of underlying diseases. In my opinion, depression is not a disease. It's not genetic. And I'll explain a little bit about that. Go to the next one. Now these are the typical degenerative diseases of our time, that they tell us they are genetic. And I'll tell you why I don't agree with that. Like, who doesn't have fatigue or brain fog? Many people say, I'm so tired all the time. Food allergies are rampant. The children in my school classes, they didn't have any allergies usually. Maybe a little bit of hay fever. Now, 20% of the children have allergies, severe allergies. What about all those eczemas in the children? And even autism and ADHD is rampant and increasing. So, of course, mental health issues are increasing. 20% of the population are depressed. And that's not good. And many people that are depressed have a smile on their face. You would never know it unless you talk to them. Because when you can't smile no more, you are really depressed. Many people try to mask it. Many people. What's the next one? Now, I asked myself, and I'll answer the question for you. Why? Why are those diseases increasing? Anybody have an idea?
Environmental factors.
Environmental factors? Okay.
Modified food.
Modified foods. We get often told it's genetic. We get just getting older. I disagree with that. The reason is, when you look back in history, even 300-400 years, when people survived the childhood diseases that killed them, like influenza, pneumonia, appendicitis, and got to a higher age, they usually were revered as the elders, the wise older people, or they were healthy and looked after themselves until nearly the last day they died. Yes, cancer was all around. Early, even in the Neanderthal, had signs of cancer, some of them. But it was rare. Not as common as here in Nova Scotia. You hear every second person has cancer of some kind. That's not good. There must be another reason in my books than genetics, because genes do not change in 30 or 100 years. They change over thousands of years. What changes is what they now call epigenetics. And epigenetics is the expression of your genes influenced by the environment. And we'll talk a little bit about that, because it's really interesting. And I quote that from a book that I really like by Dave Bredesen, The End of Alzheimer's. He's a physician with 20 years or more experience. And he says there are three main causes of dis-ease: inflammation, toxins, toxicities, and yes, environmental toxins. And I'll talk a little bit more about that because they're very important, and nutrient deficiencies. And as I always say, they all interact and go together. And it's very complex. And I go a little bit to that. Now, there's my take on genes or environment. That's a barrel model of disease. In my idea is everybody's born with a barrel of a certain size. So there's people that have a small barrel with a small spout, or a small barrel with a big spout, or a big barrel with a smaller big spout. What that symbolizes is, no, go back, sorry, it goes by itself. These are the environmental influences. These, the spout, are the detoxification systems of our body, which is liver, bowel, kidneys, skin, lungs. So if there's an imbalance to what's coming in and what's going out, the barrel fills up. And we'll talk about what I think happens when it fills up. Go to the next one. And there are some things that can fill the barrel. Picture from Germany. They have that nice saying, the drop that made the barrel overflow. So environmental toxins fills our barrel. Malabsorption, if we can't absorb the nutrients that we eat, it fills our barrel. If you have inflammation, it fills the barrel. If you have stress, not enough exercise, it fills the barrel. Even toxic thoughts fills the barrel. And there's others like hormonal imbalances, nutrient deficiencies. They are so common in spite of everybody saying, oh, we're so well nourished. We are not. Go to the next one. So at some point, the barrel is full and it overflows. And then we get symptoms. That's my take on it. And that shows, and we can actually prove that in many diseases, the disease process is present 10, 20, even 30 years before the barrel overflows, and we get the symptoms that then lead us to the doctor and lead us to get medication that most of the time just mop up the spill. So we have to keep on the medication to mop up the spill as long as the barrel still spills over. So what really should we do? Maybe we should reduce the rain, and we should reduce, we should improve the spouts and declog it. And those are all very complex issues. I just like to put it together in a little bit of a funny and intuitive way, so people understand what I mean. Because there's many, many things that work together to get us sick. It's not just one thing. And conventional medicine sadly often, not always, just looks at one thing and treats it with one other thing. And I don't like it. Next one. And you might have, and there it is again. Some people have a small barrel, they get sick as children. The barrel overflows early. Then there's other people, they can drink and smoke and dope and be in stress their whole life and are healthy until they keel over at 99. They have a big barrel with a big spout. I think that explains it a little bit. Up to the next one. Now, what do I think we need to do? We need to do a better job in aim for health. And that means A, for assess, really go to the root causes. Find out which of the many causes play the major role for you or your loved ones, and where to start changing your fate. Second, that's the intervene phase. And I think often we jump to conclusions and start intervening before we did a thorough assessment. And then we try this, it may help a little bit, it comes back. You try the next one, may help a little bit or not. And we try around forever, and many physicians, what I experienced is when you're depressed, get antidepressants. They don't work, they increase the dosage. There. And then we need a plan to maintain our health. And that is a very important thing. And what I always say, we all need to take responsibility for our own health. It's not your doctor's job, it's your job to look after yourself and your loved ones and change your fate and that of your children and grandchildren. We can all do it. Next one. Now, there's a little bit about toxins in our food, and I'll talk a little bit about food because it's so much fun. I work now officially as a certified health and brain health coach. So since I'm not licensed in Nova Scotia, that's what I choose. And it's interesting because I can say whatever I want. I'm not bound by the conventions of conventional medicine, and I'm not a typical naturopath either. So there's over 3,000 chemicals and additives in our food today. And there's way more in our environment. And most of them have never been tested. And for those who have, they have been tested by themselves. But we have 3,000 at once. Now how is the body supposed to handle that? No wonder we get sick. Our fruits and vegetables have lost 70% of their nutrient content in the last 30 years. Why is that? Agriculture only fertilizes conventional agriculture with synthetic fertilizer. They do not contain important trace minerals. They do not contain magnesium. And we breed or genetically modify fruit and whatever we eat, so the shelf life is longer, they look nice, but nobody cares really about what's in it. And that's a shame. We'll go a little bit too much to the next one. Sorry. Now, I love to talk about the aliens inside and on us. You all might have heard of the microbiome, our gut bacteria, and how important they are for our overall and brain health. Go to the next one. And there's bacteria in the skin too. And it is very often that our microbiome is out of whack. And that is not an accident, because one of the most prolific environmental toxins that are sprayed on Nova Scotia and everywhere in the world, except for in certain countries, is called glyphosate or Roundup. You might have heard of it. It originally was invented as an antibiotic because it's an excellent killer of bacteria, viruses, and fungi. But it was too toxic to use it as a medication. So Monsanto at some point decided, why not spray it on food crops? So what it does, and 95% of the population in North America, including newborn babies, have glyphosate detectable in their system. And it's just an indicator of all the other toxins that are around us. And the body has to deal with it. Yes, the body has very potent detoxification systems. But to function, they need a lot of cofactors that nobody talks about. And our conventional food just doesn't have the nutrition. And even some organic food contain pesticides by contamination from the air. It's a bad situation, but we have to deal with it. Next one. There you see a little bit how our this is very simplified, how our gut really influences our mood, our thinking patterns, our emotions. It is really fascinating. And I always say when glyphosate is eaten every day, which we do in conventional food, we need a good probiotic to balance this off if we choose to do that. I like my lemonade. It's a probiotic. Next one. Emily knows all about it. Now, I ask you one thing. If somebody that sprays pesticide needs to wear a full body suit and a harness and a face mask, full face mask with oxygen at the back, why is it okay for us to eat it? Why is it okay to be sprayed in the first place? Doesn't make much sense to me. Next one. And why don't we hear from it? Because there's big financial interest behind it. Now, you might ask, what really can I eat? Even the ice might not be safe. It would be nicer that we got today. Next one. And a good diet, eating healthy has a bad rap. My cat hates the salad. I'm an I'm eating my salad, somebody gave us donut. Oh, I like donuts. I like chocolate better than donuts. Next one. Now really, what is food? What do you think food is? What's your definition of food? Nutrients, energy. Just basic. What's food?
Things we eat.
Things we eat. Okay. Things we put in our mouth. Is it food? Generally accepted. Yeah, generally accepted as safe. You might have heard of that. It just means nothing. Go to the next one. Now, is it food or not food? No. It's supposed to be food, but really it is devoid of any nutrients. But the food industry has very many resources and has scientific studies to make their food addictive by adding sugar, by adding other ingredients that make it taste good, especially to kids, so they get used to eating junk early. And we go a little further and ask you a little bit more. Is that food or not food? This is not the cheese, the cheese slices, but that is real cheese. So that would be okay to eat, unless it's from cows that have been in concentrated animal feeding operations. So now, is that food or not food? And a vegetarian would say, no way. But I get a little bit about the history of food and why I'm not a vegetarian. So for me, that would be potentially food. Because those are happy chickens, pasture chickens, and pigs that do what pigs do. They roam in the woods. Next picture. Now, that is not as pretty. That's how we treat our animals. And having chicken myself, I can only say they have soft, sensitive feet. And standing on those wire cages all day sounds to me like torture. We shouldn't allow it. And the pigs, do you think they're happy? I don't know. Pigs have feelings. Animals have feelings. They're not like people, but they're not things, and they should be placed in the middle. There's no reason to torture them. Next one. Yeah, that's cows in a factory farm. And that's how the cows should live. They're, by genetics, used to eat grass, not grain. And the nutrient of the meat and the fat changes substantially whether you have a grain-fed cow, concentrated animal feedlot cow, or you have a cow from green pasture that gets hay and grass. The omega-3 to 6 ratio, which is all important, is completely different. You can eat the fat of a grass-fed cow. It's good for you. It's 1-on-1, omega-3 to 6. A cow that's grain-fed has a ratio of 1 to 20, which is very unhealthy to omega-6. Yes?
The reason why they won't feed them off the grass is that the farmers won't get the money. So what they do is they give them grain so they can jack the price up on the meat.
Exactly.
And that doesn't make any sense.
It has all monetary reasons, and sadly, our government, not just ours, the states is even worse, supports big factory farm instead of small family-run organic farms. They have to pay to have the designation organic, and many can't afford it because it's so expensive. Whereas big farms sometimes get the money thrown after them to make a few jobs, maybe. Next one. No, they're food or no food. Really, it isn't. When you look at it, processed meat, it's not good for you. Now, is it food or not food? That's a difficult question. And when you look at that picture on the left, there's blemishes on the apples. And for those of us that are older and actually picked apples off a tree or found the grass underneath the tree, we know natural apples have blemishes. If they don't, like the one on the right, it's probably treated with something. And the pesticides on the apples actually go under the skin. They don't stay on the skin, so even if you peel it, you'll get it. Now this is my definition of more food. Something that grows in the soil or feeds off the soil. That's food. What grows in the factory is really not food. So greens is good, and a carrot in the garden, still soil on it. Hey, it's a little bit soil. Good for you. I see children that are not allowed to even taste a little bit of soil. Children that have no idea how soil tastes. Why not? Why don't we allow them to roam free? I don't want you to feed them soil all day, but when I have strawberries or carrots in the garden, I eat them right in the garden, a little soil or not. It doesn't hurt, if the soil is healthy. Next one. Now, that's my pet peeve. Cheese whiz and Wonder Bread. My dear brother-in-law loves it. We grew up on it. Many of us do. No wonder we're sick. Next one. No, that's my dog. No, not really mine. But I like the picture because really, hey, think about it. There's a reason behind it that organic is a growing movement, sadly undermined by big food pharma again. So you have to be really careful. The best way is always to know where your food comes from, which is extra effort and hard sometimes. I wrote a little book to help with the choosing of foods, because I often get asked by my clients, now I know what I should eat ideally, but I can't afford or grass-fed meat and organic vegetables and fruit. That's why I wrote that book. I put 3 categories: ideal, acceptable, and best to avoid. And the acceptable are usually cheaper and easier, affordable options. Next one. Now, I found it very interesting to think a bit about what our ancestors ate. Now, our ancestors, say 10,000, 20,000 years ago, were hunters and gatherers. The diet consisted mainly of meat, eggs, fish, fats, vegetables, fruit, and such nuts and seeds, whatever they could find. And usually, the meat was an exception because they had to hunt for it, which is not easy and requires exercise. They didn't have any grains. Later that came, no beans, dairy, or what's worse, refined or added sugar. If they were lucky, they could get down a bee's hive of a tree and eat the honey. That was a feast once a year. Or the fruit when it was ripe. Oh, what a feast. They had some potatoes or tubers, whatever grow. And most of our history, and that's our genes, we evolved as hunter-gatherers, eating a varied diet. And it sustained them for tens of thousands of years. Yes, they died earlier from infectious diseases and accidents that we don't die from anymore. But once they got old, they were fit and could think. Now, many of you are familiar maybe with Westerner Price, and he studied, which is a very interesting read, isolated primitive cultures before other cultures influenced them. And it was very interesting what they ate. Next one. Interestingly, all native diets contain some animal products. So the types and rounds varied greatly. From the Inuits eating all animal products because they had nothing else. From some hunter-gatherers eating mostly plants and maybe a few insects. There are still cultures where maggots are supposed to be a delicious food. It's a perception thing, I believe it. All those diets contain some form of salt. You go to that non-containing refined or devitalized food like we have it today, or white sugar, of course not, the white flour, of course not. Next one. Now the classic food groups that we all know are proteins, carbs, fats, vitamins, and minerals. They are printed on each label. But what does it really mean? Next one. There's so much more which is not printed on the label. There is spices, there is phytochemicals, don't get labeled because they are hard to find and analyze. It's expensive. So food is way more than the food groups that we are told about. Way, way more. I like to talk just for a minute about the salt controversy, because we get often told, don't eat salt, it gives you high blood pressure and you die earlier. When you look in the Bible, salt was the salt of life and essential. Salt is essential for life. Sodium chloride is one of the most common elements in our body. We have lots of it. We need it. Yes, there are some people that can have too much of it. But natural salts, and I personally like the pink Himalayan salt, which only is 75% sodium chloride, and the rest of it are trace minerals. You don't get them with table salt, but you get the iodine. So if you choose to eat sea salt or Himalayan salt, you have to supplement with iodine or eat dulse or lots of sea fish in food, which is not that hard here. That's important to think about. Next one. Now the gluten controversy. Yeah, if you put up with a lot of bull, there is some great fertilizer. So most of the gluten controversy in my books is bull, because it's not the gluten. It is what we make out of the wheat. We ate wheat since 10,000 years. People had no problem with it then, until they refined it, took out all the nutrients and fiber, added other additive and toxins, and suddenly we all have problems. And often I find a gluten-free diet doesn't solve the problem unless you don't eat gluten-free junk, which is available readily. Next one. Now, there's true gluten allergy, the celiac disease. They have to avoid it, period. There's a lot of gluten sensitivity around. Now, is our gluten bad for you? I don't believe so. If you have organic wheat and eat the whole grain, I have no problems with it, unless you already have problems with your gluten sensitivity or celiac. The problem in my books is the GMO and the toxins and the overly refined food. That's why I'm always going against the Wonder Bread. We have it in the house because my brother-in-law eats it, but oh my God, it is really nothing. And fat, we have been told for 30 years, fat makes you fat. Now we know a little bit that it depends on what the fat is. I said, oh, the good kind of fat. Next one. So my answer is, it depends. If you eat processed fat and processed carbs together, it will make you fat, no question. But it's not the fat's fault. It's a processing and the amounts of quality of carbs and fats that we eat. Next one. Now that's an example of good fats. And you would be surprised that I put pastured or grass-fed animal feed fat on it, pastured eggs, fatty fish. I don't recommend salmon too much, especially not the farmed Atlantic salmon. It's sad to say that it's so full of toxins, it's unreal. Eat the small cold water fish. Mackerel, sardines, herring, anchovies, those are good omega-3 fish. The smaller the better. Now, vegetables. Of course we need to eat more vegetables. Who does it? Many people don't. And many people don't know what's really in them. And there's the Environmental Working Group, Dirty Dozen, Clean 15, that you may have heard from. And I always was shocked to read that apples, celery, strawberry, peaches, spinach is on the list of the Dirty Dozen that you best buy organic. And I never did that. And of course, the Clean 15, you don't have to buy organic. So that can be a help. And the website is ewg.org. You can look it up, the newest list. That's a very good resource if you don't have the funds to buy everything organic, and who does? Next one. And we really are what we eat. I need to be a skinny person, I think. And as I always say, there's hope for all of us. We need to make a decision to take the initiative and take responsibility for us, for our own health. It's not the system that should work for us, because it doesn't. It's a war. It's a war for our health that we are waging, and the war takes place between our ears, and that's why I'm focusing on brain health. We need to have the brain to make the right decisions for us and our loved ones. And often, lifestyle adjustments, easy ones or not, sleep, stress management, will lead to a major improvement in your quality of life, and sometimes, like with myself, to complete return. I'm healthy, I'm well, I have no back pain, I don't take any back pain medication. I do take psychiatric medications. I'm conventional doctor enough to know that conventional medications have their place. I'm not against them, but not in all cases. And not without looking first what's really on the bottom. What else could it be? And I hate to hear what they say to the Canadian and American doctors when they learn, when you hear hoofbeat, think horses, not zebras. I disagree. When you hear hoofbeats, first look, is it a typical hoofbeat? What else could it be? Could it be a rhino? Could it be a zebra? Could it be a cow? You don't look for that in conventional medicine. You should. Next one. That's my motto. And I want to leave you all with that. Don't give up. There's a light at the end of the tunnel for you too. And I mean that. I say that in each of my radio shows. It's called Healthy Alternatives. It's on iTunes, Stitcher, Google Play. It's a podcast too, in the radio show local in Halifax, but you can get it on the web. Next one. And now, thank you very much for your attention. And any questions, please go ahead, and Emily will hand out a few feedback sheets. I really would appreciate to get some feedback. And if you feel like it, there's my business cards on the side. There you can go on my website, and on my website is my podcast and a few interesting blogs.
Christina.
And please fill out your evaluation form. It really helps me. And before you go, it really helps me get better workshops going in the future. I always am happy to improve. There's no perfect. And now I want to leave you with something that I always say, it's important to be contagious and infectious with your smile. And that's why I always have a few smiles in my presentations. Thank you so much.